Bariatric surgery is surgery to help people who are extremely overweight lose weight and obtain a more healthy lifestyle. A patient's a candidate for bariatric surgery if they're between 85 and 100 pounds overweight or more, if they've tried to lose weight with non-operative means, if they've tried diet and exercise programs, have had psychological counseling and so on, if they're psychologically stable, and if they're in the best possible medical condition that they can be in prior to surgery. We do two different procedures at Pomerado Hospital. We do the gastric bypass procedure and the adjustable laparoscopic gastric band. The gastric bypass procedure is a procedure that was first developed in the 1960s, and when we do that procedure, we make the stomach much smaller. We create a small gastric pouch, and then we bring the small intestine up and hook it to the pouch. In doing so, we restrict the amount of food that people can eat, and we reroute the food around the duodenum. When we do that, people feel full on a much smaller meal, and it seems to drop their appetite set point, so their body stabilizes out at a new lower weight. In the process of losing the weight after gastric bypass, problems like diabetes, high blood pressure, sleep apnea syndrome tend to disappear fairly quickly. Usually we get really good effects within 6 months and maximum weight loss in about 1 year to 18 months. So after gastric bypass, we get very effective rapid weight loss. The lap band procedure is a procedure that was developed in Europe in the early 1990s and came to the United States about 4 years ago. When we do that procedure, we slip a band around the upper stomach. The band connects through some tubing to a little infusion port on the abdominal wall, and we can tighten or adjust that band by injecting fluid into that infusion port. And that way we can adjust it so that the patient can feel full on a small amount of food, can gradually lose weight, and then as their weight stabilizes, we can adjust the band so that they can hold their weight at a new effective limit. On average, patients lose about 55 to 60% of their excessive weight and maintain that weight loss for at least 5 to 10 years.